Hello, everyone. Welcome back to Ortho Forward podcast, hosted by Dental Monitoring. And today, the focus is on SprintRay. I have Amir Mansouri, CEO, founder. And actually, I'm pretty pleased tonight to have Amir because we actually created our company in the same time. So we are celebrating our 10 years anniversary same year. And so I think there is a kind of parallel. We are disrupting the world of dentistry and orthodontics, and so I will be really intriguing to all your answers that you will give me, and I will, of course, in my head make some parallel to dental mentoring. So SprintRay for our audience is a 3D printer manufacturer, so 10 years old, very innovative with more than 10 use cases. Sorry, surgical guide, crowns, clear aligners, retainers, lots of things, and I hope Emir will go in more details into that. You are also strong innovation in resins, plastic, but since not a long time, I think, some ceramics, and we'll be pleased to hear more about that. And of course, now nothing works without a very strong platform, digital platform. And I think, especially in the collaboration with Dental Monitoring, I would like to hear more about your software and some AI tools, maybe that you would have in stock. So, Amir, Mike is you. If you can introduce yourself and a little bit about the company.
Thank you, Philippe, and it's a pleasure to be here, my friend. Thank you so much for inviting me, and congratulations on the 10-year anniversary of dental monitoring. It truly takes a decade, my friend, to build something amazing. It's not overnight, it's not a hit and run. You have to have the perseverance to stay in business, solve customer problems, have enough passion to survive that long. So, congratulations to you, and very excited to be here.
I send you back the same compliment. 10 years of and bringing a new product in the printing business was not that obvious at that time.
Absolutely, yeah. Back then, when we started, we didn't want to be or didn't know about dentistry. This is 2014 when we did our first prototype and we showed up to a not a dental, actually 3D printing trade show in the San Francisco area, and it was just all 3D printing manufacturers. There was no single dental part in our booth. I still have pictures, 2014. And 2015, when we did our first Kickstarter campaign, that's how we did a crowdfunding platform to sell our early units, we still were not that familiar with dentistry. It really, for us, dentistry happened in 2016 with one of the Kickstarter backers. Bought Glidewell Labs. Everyone knows Glidewell.
Mhm.
Bought one of our printers, and we found dentistry. And when we found dentistry, we never we ran with it. We really essentially put aside every other industry. We said that's it. That's our niche. No one is focused on it. No one is developing unique solutions for dentistry. And we want to be just a broad dental ortho focused company to be able to solve their problems, give them more options and alternatives.
But a first question that comes in my mind, because it's already for us always a challenge, is to keep the culture of the first day, the culture of being able to change, to be able to bring innovation in the center of every conversation. How do you foster this culture in SprintRay today?
It's a very good question. It's people call it culture. I call it DNA, and I've learned it over the past 10 years at this point that the moment you yourself lose that, it starts to fall down, and the moment you're not intentional about it, that thing essentially just become mutiny, become different, something different than what you wanted. And you know this, Philippe. You go through the different phases. And every time that you go through a different phase, different inflection point, you reinvent yourself while keeping the core passion and DNA. For us, all founders are engineers. We're heavily product driven. We're heavily innovate fast, do product management fast. And we try to keep it all these years. We overwhelm ourselves by the number of new products we're launching in different software, hardware, and resin. Our head of marketing says he's never launched this many products in a single company. Every other company he's been, it was one or two product lines. And we're not talking about features. We're talking about new SKUs, hardware, software. And that is our DNA. We love to make good products, be passionate, solve issues, move fast, iterate. And over years, we went through phases that we were not doing it, and we saw the immediate impact of falling behind, losing our glow. So we started to get it back. So that's it. To me, it's the passion. You are every day the driver of that culture, and you need to be essentially pushing this day by day.
So, when I hear you, it seems that so then companies, startups companies, and company like us are too much dependent on their founders. Then
It is very true. And one of the challenges I have these days is to codify that product management methodology that we developed purely out of nothing, out of intuition and figuring things out, to be able to scale at the minimum, the product development part of it, I would say, scale it beyond the founders. In SprintRay, we've done it in marketing, in sales. It really grew beyond our imaginations and our skills. But in the product, is heavily founder driven, whether in the technology, whether in the product development. And our team has grown to right now 20, 30, but the head of the helm of these troops is all founders. Me and Haas, chief product officer on the product management, and Jing on the technology side. We're still every single day driving it. And it's true. That's why when you've seen it, founder-driven companies get bought out or sold out. It's not the same thing. Majority of them don't survive in a bigger environment. Majority of them don't. If a new company buys it, it's not the same company anymore. You saw it with Serac. It was different, and people were driving it, and it became part of Dance by Sirona. It's not the same company. It's not the same product line.
Look, I'm not sure of that sometimes because and it has always been my objective, my personal objective is to surround myself with people that I found more brilliant than me. Sometimes it can be a bit scary because when you look your management board and you look at, I'm actually the dumbest of the room. Sometimes you feel a bit scared, but actually me, I feel better because I feel if I do that, my company will be driven and survive beyond me. And this is my primary objective because the values that we want to bring to the market need to survive after the founder period. But look, so if I come back to that, can you give me some key milestones in terms of product in SprintRay history? Some of the mistakes that you did, some of the mistakes that you will not do again, and some of the success that have bring SprintRay to where you are, because you are leading the market on that, on your field.
Yeah, very true. So probably the big milestone over the years was when we put together a material development team. This has happened 2018 when we soon realized that to be relevant in the dental and ortho 3D printing market, you have to be a material company and use the hardware and software to form the material from liquid to solid. That's all it is. The better the material, the more relevant you are. Because I'm a mechanical engineer, my founder is a mechanical, the other founder is an industrial designer. We really started as a hardware and software. So probably biggest decision, one of the best decisions we made in 2018 was to start doing R&D in the material science part of things. And we put together a team. That team is right now pretty large. It's one of our largest teams, and probably the best decision we made. The second best decision, the first best decision was to focus in dentistry, pivot everything to dentistry.
Yeah, true.
This is the second, to become a material company. And over years, putting together that team, and once the first few products came out of that team, it was pretty revolutionary. The first couple of products were coming out after 2021, 2022. And this AAO 2 months ago, we launched first retainer resin, a material that we can claim it performs for the retainer. It lasts as a first aligner, last aligner as a retainer, and lasts and it's elastic and it's durable and it's clear. That was a big milestone for us because for years, many people were claiming it and we were not comfortable to bring a product to be able to be printed in the office, in the lab, to be used as a retainer. That was a big milestone. The introduction of our Midas printer. It's not quite an ortho printer yet, I'm saying yet because I can't share what we're up to
Come on,
in
you've got
the
lots of
back.
orthodontists listening. You want them to be
But
teased.
very true. But Midas' footprint, Midas' ingenuity of the way we polymerize things can be scaled into orthodontists, and we're working different approaches. So these two were pretty big milestones for SprintRay, and we're very excited about them.
Can you run me through the workflow today? If I'm an ortho, I'm doing heavily aligners or braces, and how do you feel SprintRay can change my life?
The first thing, easiest thing, is probably doing your own retainers in the office. This is something that you have to do it. And I'm not talking about direct printed. I'm talking about printing the mold, doing thermoforming. Every orthodontist is familiar to it. Just the versatility and the ability of doing in the office. I'm not just talking about saving money, because there's insane amount of cost saving when it comes to big retainer companies or smaller, even the cheapest labs. There's a huge price gap that they can save, pass it to patient, get creative, lifetime warranty, things that they can do that you cannot do if you're outsourcing it. I actually made a visit yesterday to my friend orthodontist, one of my close friends in Santa Monica, and I'm having a lingual braces as I'm speaking with you. I went to change the wire. He was cranking out printing retainers. It was his, I think Thursdays are his debond days, and today he was getting ready for the next set. It was when I visited them yesterday on Monday. So he was cranking out, and this was a 40-year-old printer. And it was just cranking out. How many models do you do? He said on Friday it's probably 40 to 50 retainers is what he makes. It's amazing.
Yeah.
Just cost saving aside, the ability to turn things around, give two to the patients, take care of them is phenomenal. You have to do it if you're running an ortho office. And same day retainers, patient come back, they wanted the last day they're traveling, or you want to create a faster workflow. The only way to do it is if you do it in the house. So that's what we promote everyone to do.
And actually, with our customers using Smart STL, which works on SprintRay, they could actually download the Smart STL from the comfort of the home of the patient, print the model, thermoform the retainer with a SprintRay machine, and when the patient is on the chair getting the debounds of the braces or the attachment, boom, get the retainer the same moment.
Very true. And our systems are super compatible. Probably next stage is integrated a bit deeper, so we can go directly from your portal to the printer here. So once you send the Smart STL, it shows up here. We have the API. Let's commit on this podcast to make it happen for our mutual customers. But
okay,
I agree with you.
I commit that my team will work on that. You commit?
Yes,
oh my God,
course.
people are listening.
We'll make it happen. Yes, people are listening. We're committing on a podcast team, so we have to make it happen. So that is something very consequential. And then we come into people who want to do, I would call easy cases in the office. I don't usually recommend doing all of your retainers or aligners in the office because it becomes a lot of work. It becomes like a production. We saw a big hike and a spike of people doing it in 2018-19, but it kind of normalized. Now, the orthodontists I work with, they use it for easy cases, 5 tray. They debond, and they took the braces off. They want to quickly create another aligner, another 1 or 2 stages to finish it with aligners. Those kind of things, we see it happening, maybe 3, 4, 5 trays. They quickly turn it around in the office. It's much cheaper if you do them in the office. It's much faster. They want to deliver it the same day to the doctor. We see that happening. Then we come to the IDB trays, whether it's you do it in office or whether you work with an ortho lab who is printing with you, is you're using 3D printing, and people who wants to digitize their bracket placement benefit from that heavily. I think these are the 3 very common and already established workflow that is happening. There is also super innovative workflow I see every day, whether printing some of the devices like space maintainers, those kind of things directly. There are companies working on direct printing of brackets, which I think is brilliant. It will happen, but it should solve the right need. It's not like this is a hammer and everything should be printed. It should be the right case for the right reason, not everything get printed. And I think this just keep growing. And now go ahead.
Yeah, did you try your retainer resin for the mouse guards?
Yeah, well, we had the mouse guard resin for many years.
Okay.
And then we started to R&D on that to make it more flexible. This is one of them that I have right now in front of me. It's a pretty good durable, and I had it for my case before my lingual braces start to ship. But the next phase of this is to customizing your own designs for retainers. Multiple thicknesses. People want to add a bit more occlusion, kind of combine night guard and retainer is one. I see that happening very soon. It's a matter of how AI will catch up and how design is facilitated. The tech is there to print it. Now we need the right design software to make it easy to use in the office. The staff do it, and it's happening. And I think the game of printed aligners will come. I see it more a lab procedure than a in-office procedure, but regardless, printed appliances, you have unlimited control and creativity over design. We're going to see an influx of innovative designs that cut treatment time, that make treatment faster, that is more comfortable coming in the next few years.
All these technology are highly dependent on the quality of the software you're using on the side to do the design.
Correct.
What do you recommend today?
100%. And for designing, if you're doing in office, ULab and Archform are both our good partners for treatment planning. When it comes to the other part of treatment planning, I think you guys are great partners. Dental monitoring, the Smart STL, 100% for retainers is recommended. And there is also a lot of design services companies that doctors don't necessarily want to design themselves. They want a technician design it, they approve it, or they comment. We have our own right now in our portal. There's so many other services, amazing ortho labs that are providing those services that can be done.
But everything is compatible. It's a generic STL file, and
correct.
You do the cleanup of the STL file and print it. And
correct.
Okay.
Correct.
Okay.
Once we receive the STL, we run our own pipeline of algorithms to make it ready for printing, from orientation to support. Like printing retainers is very tricky to get the clarity. We ran a lot of different experimentation and built models how to orient it to get the clarity out, to make post-processing easier. So these are things that we're really good at. And once the STL is passed from you, we can handle the rest and even load it to the printer. That's my vision, to bypass all the software, load from dental monitoring directly to the printer, go here and hit print.
We're committed, right? We have no choice.
Make it happen, my friend.
we have to do it. Otherwise, we will look cool. Okay. Look, innovation and new things. I heard about Midas.
Yes.
It looks a very nice name, like a movie name. Or or some Greek names.
Greek god. So Midas was a project that was purely, again, we talked about founder driven, and our founders are leading it. It wasn't more about bringing smart people. We have so many great engineers, but it was more like the passion of the founders and the ability to give it to the next generation of team members, the sprinters. Midas happened out of pure genius of my CTO, and he has 100 ideas, and 99 of them usually don't work. But one thing we learned from both of us were PhD lab mates at USC, University of Southern California, and fired onto all the Trojans. You have to experiment. You have to try things. And this is one of our mentors at USC taught us. It's failing. You have to go try it. You have to build it. You learn from it and inspire you for the next phase. And this is mostly for the hardware. It works very well for hardware products. So when he told me he has this concept, I was like, you know what? I don't think if this work, it has so many reasons not to work because he's reversing the whole printing process using Pascal principles to really pushing pure physics, basic physics, and making the platform a passive part to be able to push a super viscous material into a chamber. There are 99 reasons this thing is not going to work, but you know what? Go try it. So 2 months, 3 months, he was doing his own skunk work. He came back and said, Amir, it's working. Check it out. So we built the first prototype about 2 years ago.
But you need to explain. You need to explain to the audience what it is, because for the moment they probably are like this. But what is speaking?
Yes. So Midas solves two problems. One, the experience of 3D printing in general is very messy. It's very open architecture. You have resin tank platform. And what we did in Midas, we turned it into single-use Nespresso style. I think coffee makers are the best example. It's very relevant analogy. 3D printers are like these coffee drip machines, very popular, that you got to put a filter, grind your own coffee, put the water, wait for the water to go, then throw it to trash, clean it, run cycles. This is 3D printing today. There are many different ways you might not end up getting a good print or a good coffee. If the filter is bad, coffee is bad, coffee is too old. Midas is a Nespresso of 3D printing. It turned everything compact into one cartridge, and that cartridge is the 3D printing. Is not the printer anymore. The cartridge is the 3D printer, where we have, yes, there we go. I have one cartridge that is done here. You can see it again. We should do overlay.
Okay, yeah.
So you get one cartridge or capsule, you put it in the machine, at the end you get one crown, one inlay, one inlay. It's a very restorative printer at this point. Again, I said yes. That's problem number one. Problem number two that Midas solves is material viscosity. Traditional 3D printing, conventional 3D printing relies heavily on flowability of materials to get a good print. And in dentistry, when it comes to printing aligners, retainers, when it comes to restorative 3D printing, the materials we love that give us good performance, they are super thick, they're viscous. You can't print it with regular printers. There have been so many attempts to make high viscosity 3D printers, but they've been so cumbersome, so expensive, $500,000 US dollars of price tag. So Midas also solves that problem. Right off the right from the get-go, we can print parts that are 10 times more viscous. And that opened up a whole new world of material that were not available for 3D printing. We're getting crown materials that are more durable, more wear resistance. We can print super thick materials that are great for retainers, aligners, and these are the direction we're taking it. So that's on Midas. The name is also a very cool story because it was our R&D code name. Every one of our R&D project has a code name. We go from astronology. We used to have all the stars, and then we switched to Greek gods. This one, our head of R&D, Tim Tian, is one of the guys who's been with me from 2016. Pretty much my right hand. He called it Midas because he said this product is our golden touch, and Midas is a Greek god that touches everything and turns into gold. And we picked that as a code name. And when it came to picking a name for the marketing, our marketing team couldn't find any better name. We said, as you said, it's like a movie. It's unique enough that grabs people's attention. We loved it, and it's been great. I actually have it here next to me too. I tried to push it to the screen if I can. This is Midas. It's very small. And you can compare it with Pro 2, which I will explain what it is. But it's the whole compact form factor, the whole portability, the whole cleanliness. There's no lid anymore. There's no resin tank. This is the cartridge. This is how the size of it is. And once this red piston is pressed, essentially this red piston pushes the material into the build chamber on the bottom. Okay. And as I press it down, the platform comes up from the other side, and the part is built like this. Okay, so it's very innovative. It's unique of its own kind. It's also a different category. It's probably the 3D printing this year is 40 years old. Chuck Hull invented it in California, and I think this is a one major leap to the resin 3D printing technology after Chuck Hall, the godfather of 3D printing, invented it. And this is how the cartridge is. You just place it here. This is one cartridge. You see, it accepts 3 cartridges.
Okay.
1, 2, 3. And
That's it.
it's a matter of, that's it. You press the button, this arm comes down, pushes the piston down, and then you get a part done. That's how it happens.
How long to get the part?
10 minutes for the crown and inlay,
Wow.
onlay, shoulder, veneers. And it's 3 cartridges take the same 10 minutes. It's pretty revolutionary in terms of efficiency and what can be done. And this is what our Ivoclar partners excited, because the ability to do better resin was something they were also after. And once they saw it, the chemistry was really there to do the partnership with them, and trying to convince them to get into the ortho world. They've been super focused on the restorative world.
Of course.
But imagine
they are very strong in
into
that.
very strong restorative, but I'll convince them. I believe in my convincing powers to get them into the ortho. Let me explain Pro 2. Pro 2 is our, at this point, 4th generation 3D printer that uses the conventional technology, but it's the most advanced, the most accurate 3D printer that we built. This is our ortho printer today.
Okay.
This is what orthodontists need. It will triple the accuracy of the Pro S95 that they had, and they were printing their aligners, retainers, IDB trays. It also uses a brand new wavelengths of 385 that would take accuracy and dimensional stability to next level. Also, the new materials that we're all baking and cooking, our retainers, the new bracket stuff that we're working, they're all compatible on this resin because of the wavelength and accuracy. Some of them are super accurate stuff that they're not able to do it on the past. Unfortunately, it got undershadowed with Midas, but it's a beast of a 3D printer. When it comes to doing retainers, we can do aligners, retainer models, your smart STL models in 20, 25 minutes. You can print it. You can do, if you want to push the one set of tray at 170 micron, you can push it around 10 minutes to be able to do a set of models, 8, 9, giant platform, 35 micron accuracy. There's nothing else like it. It's one of the, this is the printer that our orthodontists are keep upgrading right now. There's a big wait list for it too, that are essentially upgrading from older one to this one. Midas is more restorative today. Let me pause here, see if you have any questions.
And I'm not sure, and I'm not sure that Midas is designed in its concept to do ortho, because the cartridge itself, the size, the volume of material that can be contained within one cartridge is really designed for one tooth or one or two tooths. But to do a set of retainer with a cartridge means that you will need to be behind the printer to change the cartridge. So I'm not sure really that the concept of Midas would work for retainer. I'm right, or you feel I'm wrong?
You're absolutely right about that. The current architecture is not optimized for ortho, but the underlying technology is there. That means we need bigger cartridges. Maybe right now this machine takes 3 capsules. Maybe but the next one needs 10 capsules. That is an ortho system. The technology is so scalable that we can just do it more. We were very excited to take Midas to the market as fast as possible. The whole process took about 18, 19 months. Because one thing, again, back to what we spoke at the beginning, founder-driven companies are amazingly fast in product development. And one thing I learned, you put the product in the market, people use it 50 different ways that inspire you to do different things. And that's why we're putting it as a phase 1 as a restorative printer. You're absolutely right, because this architecture is not ortho. But never bet against engineers. I think one thing I learned, you never bet against engineers. Our team is heavily working in scaling this technology further.
And so if we speak about your product roadmap, so today you just released Midas, restorative product. Great. Honestly, the analogy with an espresso machine is brilliant, and because I don't think that dentists want any more complex system in their practice. We are heavily working on bringing DM to the next level of simplification with getting the high value of DM, but with a very, very simple approach. So I love the fact that you are doing this for the restorative. But what is a product roadmap that you're very proud of, and maybe you can disclose some things or not? I don't know.
Very true. Besides making these hardwares better, faster, Pro 2 is just shipping. Actually, we're shipping the July batch. We're very excited about it. It's the best conventional 3D printer I think anyone ever built. It's definitely the one that we've ever built.
What is the price range?
It's $10,000 US dollars. I think it's going to be similar. We kept it very affordable. We didn't raise the price. A lot of companies raised the price. We kept it below 10. It's not price gap with the previous generation. We also lowered the previous generation by another $3,000, so a lot of people can get it started. But it's an absolutely workhorse of orthodontist. Also, the level of details you get out of this, the anatomy you get, it's just order of magnitude better than the previous generation.
To get started, do you know some specific training? Do you need to, what is it, a reseller approach, means you have a distributor, or can we contact directly SprintRay? How does it work?
It's a reseller network. In Europe, 100% reseller. In US, 95% reseller. 5% is some special high demand DSOs or sophisticated DSO organizations. I think they are on the direct side. Then the training is combo of us and our distribution partners. Back to founder driven, you know this, Philippe. You can't delegate that to anyone. This is your baby. You got to train everyone on it. You have to make sure the training is approved by that. So it's a joint effort with our distribution partner. We're heavily involved in that. We make sure customers get trained. We make sure they can use it. But some of our distributors are doing also a phenomenal job of getting our customers trained.
And so how long does it take? How long a doctor needs to allocate to train the team?
1, 3. They can choose either our Zoom sessions, which is 3 hours. We go over
So it's
how to load this. Yeah, super quick. And some doctors choose in office that we can send someone to their office. That's obviously requires scheduling, is a little bit more costly because we have to fly people. But some people like it. They shut down the office, train the staff. We also have a lot of courses in our own headquarters, both in Germany as a European headquarters and in Los Angeles as America's headquarters, that they can bring the staff, they can come back for training. Doctors sometimes lose their staff, there's turnover, and that's how they essentially come back for training and retraining.
So to switch back to ortho in general, so we see lots of conversation around direct printing of aligners, and you slightly speak about that. So where do you see this going, the maturity of it, and what is your opinion? Because I've looked at many companies speaking about it, but I would like to have your opinion on that.
Very true. It is already happening. I think since IDS 2019, I saw the first companies talking about it. Obviously, it was very controversial. It was very contrarian, but they stuck around. And whenever something stick around, that means there is something there. Mm-hmm. Today, it used to be very complex to do post-processing to get the essentially plastic-like properties. We see those getting better with our retainer resin that we just launched. We don't have any of those funky post-processings that you have to put it in this, put it in that, this temperature, that temperature, wash it with glycerin, those kind of things. So as a availability of technology...
So just to make it clear, for your new retainer resin, this one is just you print, you clean, and that's it.
That's it. You deliver.
There is no post-processing of polymerization.
Just clean and post-cure just like anything else. That's all it is. So that is already happening. That comes to the printing. And I think we will extend this later to aligner, whether it's for the lab or in office. Let the market decide where to use it, but we will expand this offering later to aligner. The part that I think will need work is design. There is not a good design solution out there yet. Every design is for old school exporting the models. Also, haven't seen much of creativity around designs happening. Haven't seen much of AI happening. I think that needs work for this to work. Mm-hmm. So That's the area it's not ready yet. The third piece that I always say is more than 20 years of, at this point, I think 25, 26 years of goodwill on the thermoplastic sheets.
Mm-hmm.
The clinical data on those are astonishingly good, performs. Even if we have everything, it's going to take a couple of years, a long time of clinical work, whether academia, clinicians, doctors, to be able to prove that this is as good or better. I think because of all of this, it's not this year or next year, but in the lifespan of 3 to 6 years from now, I think we see more and more direct printed happening. We saw companies right now talking more building software development for it. We see a lot of acquisitions are happening in that. There's no doubt in my mind that we will be printing aligners in 10 years.
And so you were speaking about acquisition. You are still independent as DM is independent. It's very rare. Most of the company are profile, very innovative, blah, blah, blah. At one point, boom, a big player come, make a big check. Why not you? Why not DM? Me, I know, because I love what I'm doing. But you,
Right.
what is the reason? Why is the reason?
I mean, every other company, as you said, either ran out of money or sold. So, that's the typical story of startups. I mean, for us, we're loving what we're doing, and we're executing on our business plan. We're financially very stable, and that gives us the ability to keep growing the company without requiring additional capital or getting desperate to sell to bigger boys. And we're extremely passionate with the product development. We're believing that this is the early days. We're just scratching the surface of what can be done in orthodontist and restorative. An advisor of mine said this a week ago. You just grab the tiger by the tail. So there's still so much opportunity there. So because of that, we never proactively started to look for sale. We're not, again, when we started, this was not a path to make a quick buck and move on. It's been a decade we're here. So we continue with that mindset, heads down, execute, build good product, take care of your customers, create a good culture, make innovative products. And along the way, I think we see what happens. So far, we've been able to keep it independent. We're enjoying it. And who knows what's going to happen in the next couple of years.
Tell me, Amir, can we say now that both companies, we are not anymore startups? 10 years, still independent, still loving it? We are there to stay now.
Absolutely. The culture is definitely entrepreneurial startup-y. I think to me, when your business plan works, I mean, you're sustainable, profitable, turn EBITDA positive, you don't need to raise capital to sustain your company. That's when companies transition from proverbial startup. But the mindset, we always stay like that. As long as we're around, we prioritize customers, we prioritize product development over profitability. That's my definition of a startup. That's why startups win and bigger, complacent companies cannot.
Fully agree. So just to end up on this podcast, and I would like to get your mind on outside SprintRay, outside DM. What do you feel the 5 next year of ortho, not dentistry, because I'm not competent to speak too much on dentistry, but on ortho, where do you feel the ortho field will move in the next 5 years?
I would call it, if I just want to purely brainstorm with you, right, without much of deep thinking, sharing with you my high-level thoughts, I think two ways, two directions. One, we're going to see a tremendous way of software-driven treatment plannings that cut treatments to a third, to fourth. AI has not penetrated ortho yet, in my view. We're using AI to treatment plan, but we're not cutting treatment time. We're not collecting these data to see if this treatment work, to see what's the right strategy to get there faster, get them more stable without hurting the patients. I think that's the area using 3D printing to come up with innovative appliances that can do things better, faster, stronger. Right now, I'm wearing a lingual braces. It was a nightmare to go through it, but man, it's so efficient.
Yeah, it is.
Why this is...
You know that I developed, my first company was actually to create one of the strongest lingual company in the past.
Amazing. Congrats on that. It works. It's so efficient. Yesterday, I got the second wire. I can't believe that it already did the job 24 hours. But it's a nightmare. No one wants it because it's tough. Why we don't have printed appliances to do the same thing and doesn't hurt the patient tongue the way I'm having blisters? I think that will happen. That will happen.
You have a new company to start.
Absolutely.
Very comfortable, easy to play lingual appliance.
Very true. This hasn't happened. What I'm wearing is phenomenal. The results is there, but it's not a scale. I think that's one direction. The other part I haven't seen much of research is the impact on DNA and teeth.
Okay.
DNA and ortho. When you see my family, my mom, I had my upper, I never had ortho. It's perfect. I was, I think, lucky.
You're born
genetic
handsome,
lottery.
right?
Yeah, I don't know about that, but
you've got the
really,
nice haircut.
genetic lottery. But my mom is like that too. My sister is like that too. That's definitely somewhere in the gene. Where is that hidden? No one has done research on that. How can we alter that to influence the tooth erupt straight? I don't think if our orthodontist friends like that or not. We don't want to put them out of jobs.
Yeah,
but I think we're just beginning to crack the code on DNA in general. And once you come into tweaking that, it's going to become an interesting field of dental and ortho treatment. So very exciting future.
Very exciting future. In my sense, we are going to a far more data-driven orthodontics, where decision, as you say, for ortho planning, for speaking and convincing the patient on the right decision, this will be far more based on data and facts.
Absolutely.
That just
good.
experience. So, Amir, thank you so much for your time today. It was
Pleasure.
Great to have you. Congratulations for Midas. Congratulations for your new printers. Look, I will be following you. I know that we will be coming closer and closer partners. We have to integrate. Oh my God, we have to do this.
We
quick.
shook hands.
Yeah,
shake hands on it. Yes.
Yeah, we have to do it. My team, I hope you're listening. So see you soon, probably on the next show. And look, let's make it happen.
I appreciate it, Philippe. Thank you for having me. See you soon, my friend.
See you. Thank you.